Hi, my name is Lindsay and I'm a registered psychotherapist. I've created this series called Walk the Talk to stress the importance of therapists practicing what they preach when it comes to sharing skills and creating habits with their clients, but also to give my community, my clients, a little inside look at the different habits and the different routines that I have throughout my day to manage my wellness, my mental health overall. Today I wanted to talk about the importance of seeing self-care as our job, specifically if we're working in a helper role. For me, a helper is anyone who works in any way to help other people. Simply put, this can be nurses, physicians, dietitian, personal support workers, personal care workers, social workers, anything where in our role we use our full selves and we prioritize the need of others, right? Teachers are also in there too. Don't worry, I didn't forget about you. For me, I stress the importance time and time again of creating time and space for self-care or self-nourishing and really seeing this as a part of our job rather than something that gets pushed to the bottom of our priority list on our own time. It's really important to create time to fill up our own cups, because to be cliche, if our own cups are filled, we can't fill others. And so this is something that I started to take really seriously when I got my first job working for an agency providing mental health service. And I realized that, I'm going to be working with a lot of people who are struggling. And, this is going to be hard for me to help support them, even though I've gone through all this training, and that's a normal part of it. So I need to make sure that I'm creating time and space for myself to re-energize and to fill up my cup in different ways so that I'm able to give more to my clients and I'm able to help the people that I'm working with without sacrificing my own mental health, my physical health, and my overall well-being. And so how do we actually do this? How do we create time for self-care? So first of all, self-care is not simply paying for massages or paying for services like manis and pedis. Yes, that can be part of it, but this is a little bit too stereotyped and, too close-minded when it comes to the portrayal of self-care in the media. So I really see, self-care, I like to use the term self-nourishing more. So it's really doing things, anything that we need to help feed us, mentally, emotionally, spiritually, as well as relationally. So when I think about a self-care plan, I'm looking at all of these different aspects. I'm looking at what do I need for my physical well-being. I need to ensure that I'm eating in a way that works for my body and for my individual needs and intolerances. I need to make sure that I'm getting enough movement to keep my energy levels up and to keep my stress levels down. I'm looking at that spiritual aspect. So for me, this is about, going for Reiki energy healing sessions because, I find value in that. It's also, making time for meditation in the morning. It's also making time for silent walks with my dog in the morning. Then we look at the emotional side. So what am I doing to take care of my emotional well-being? So I'm learning about, how to manage my own struggles through practicing self-compassion. I'm going for therapy. I am, taking time to journal. And then, looking at any other aspects, having time to socialize. When it comes to figuring out, what are the different aspects that I want to be including in my self-care plan? Yes, I've broken it down into these different categories. But another way that we can look at it is simply in terms of our energy input and output. So if we think about our energy in terms of a battery, we want to look at what are the things that use up my battery throughout the day and what are the things that recharge it. So generally speaking, for the most part, as helpers, when we're in those roles, when we're at work, that is, oftentimes using a lot of our energy and depleting that. Sometimes we have clients that can be very rejuvenating, but, other times we can be working with people that are dealing with a lot of pain, a lot of struggles, and a lot of adversity, and so that can eat up our energy. So we want to be looking at, what are my responsibilities and my duties on, over the course of an average day, an average week that is sucking up my energy? And what are things that I find that I would like to be doing more of or that I'm already doing that help to replenish it? Research shows that when it comes to replenishing our energy from a physical side of things, that this is, movement is super key. Getting any kind of movement, walking, dancing, running, having sex, doing yoga, right? Chasing after the kids in the backyard, chasing after the dog, or whipping the ball at the dog park, whatever it might be. This shows that any kind of movement really can actually help to increase our energy levels, right? So that's just one little tip in terms of the scientific side of things. But you want to just do an assessment of, you could start off with, okay, let's write a list of all the different things I'm doing throughout the day and reflect on, does this take energy or does this give me energy? And you can simply create a list and use plus and minuses to represent if it gives or takes energy away. And then look at what the total is. Do you have more pluses or more minuses? If you have more minuses, you want to look at, okay, from these different tasks that I have throughout the day that deplete my energy, is there anything there that I can delegate? Or is there anything there that can wait till later and is actually not really a necessity and doesn't absolutely have to get done right now? Then when we can, hopefully remove a couple of those depleting activities, we want to look at, okay, what could be some other things that I would like to do that give me energy but I'm not currently doing? So this could be anything from spending more time with the kids, spending more time, at the dog park, getting outside more, phoning family members more. Whatever it is, just take some time to create a list and then look at, okay, how can I get my, inner circle? How can I get my friends and family involved to help me balance out my energy levels? This is where that delegation piece really comes in, especially, if you have kids or you have, caregiver responsibilities outside of your helper role. So this is just a little bit of a sneak peek in terms of, how I've assessed my energy levels in the past and how I've made readjustments to self-care to be able to ensure that I can keep those energy levels up so that I can give to others and be my best with people that I work with. So with that, take some time to do a self-assessment, even just do 2 or 3 days out of a week to see how your energy is being taken away or replenished, and think about, okay, what is one thing that I can do this week, even for 20 minutes, that's going to replenish my energy. Maybe that's, after the kids go to bed or after you're done your responsibilities for the evening, can I put on my headphones, go into my room and dance around, or, jump around on the bed and just, feed your soul or feed your inner child, right? So take some time to reflect on what works for you and stay tuned for the next Walk the Talk.